First of all, everybody, thank you for joining us. We hope this is going to be very helpful in giving you a little bit of support and guidance in anticipating this year. Obviously, for parents of kids with pre-existing conditions, it's always a concern in the back of our minds of, even if your child goes away for a weekend, what if, even if they go away to camp for a month, and sending them to Israel, of course, is much more complicated, and that's putting aside the pandemic. It's much more complicated to deal with a whole year. Most insurance companies aren't going to give you a year of medication in advance. Traveling is going to be challenging this year. And there's a lot of unknowns that we all have. So I thought it was really important to do this. A lot of the survey that we did for parents showed that a great majority of parents were not entirely confident in the plan that they have for their children, for their students. You know, many people had a lot of confidence. I would say about 25% of the people that we surveyed felt very confident in their plan, but the rest of the parents didn't. And I want to give you some confidence and information to be able to deal with things as they happen, and also to be able to anticipate some of the issues that happen with students. And I'm going to cover in this session, and I'm turning this way because the notes of the things I want to cover are over here, so I apologize. We're going to cover basically generally adapting healthcare services for the corona virus in Israel. Prescription medications is obviously a big issue. Mental health and physical health is a big issue. Some proactive tips we're going to talk about as well. And gaining some confidence in your child's plan is really getting the knowledge and understanding. So we're hoping that that will be the end point of this meeting. We talked about prescription medications. So I'm going to talk about the general situation here as far as pre-existing, and obviously there's a wide range of pre-existing conditions that students have when they come to Israel. We're trying to cover the basic ones in this meeting. Obviously, we can't cover everything because there's too many. But in general, during the pandemic, during most of the time, regular services are available, excuse me, in outpatient settings. During the peak of the pandemic, however, certain hospitals will stop doing routine procedures and routine services because they really have to focus all their resources on the pandemic. This is going on in America, this went on in Europe, and this is something that we're seeing internationally. During the first wave, Israel actually shut down all non-urgent healthcare services in a hospital, let's say, for a few weeks. During the second wave, which we've had, and we're, you know, we've peaked and now we're starting to actually come down, we saw much less of that. We really saw only 1 or 2 facilities limit their non-urgent health services. A lot of the kind of services your children will need can be done either completely outpatient, which is in private doctor's offices, private labs, that kind of thing. If your child requires infusions in an infusion center, for example, those are considered urgent, and so you should be able to get those infusions without a problem in the outpatient clinics in the hospitals. There are alternative spaces as well, but those are generally working. And the good thing is that the whole world is really coping better now than we did at the very beginning of this pandemic. So it's less likely as time goes on that more resources will be limited. So I think we're going to be okay with that. So basically, the way that it's been working in terms of Emergency rooms. A lot of people ask questions about that. Most of the hospitals during the peak of a pandemic have limited the number of people who can go into a hospital as a non-patient, so as a support person. In the past, there hasn't been a limit. Someone's in the emergency room and their whole family is in the waiting room. It's, obviously that's a different problem, but there has never been a limit, and now there is a limit. So sometimes one person is the limit. There are going to be times when nobody can go to the hospital with the person. So that could happen. Again, we are only anticipating based on how Israel has behaved in the first wave and then subsequently in the second wave. So we could only base our opinions on what has actually been happening, but obviously everything's up for grabs. But we're moving in a better direction where things are more organized, and they realize like you have to provide regular care for people even during a pandemic. So that's good. We're going to talk a little bit. I'm going to answer the questions that people sent to me. If you have other questions, feel free to use the chat. I am not going to answer questions that are not about pre-existing conditions because it's not relevant to this chat. Some people sent all kinds of questions to me that had nothing to do with pre-existing conditions, and this is not the forum for it. So we're going to talk about that. We're going to start with mental health. We're going to start with ADHD, which is a very big problem, obviously, especially during quarantine. We had the experience of helping hundreds of kids this spring who had to be in quarantine. A lot of them had anxiety, depression, and ADHD. All of the parents were very anxious about their child being stuck in quarantine with the and oftentimes, remember, the country was less prepared then. So our quarantines were usually just a room with a bathroom. And now the schools are trying to adapt a little bit better so that the kids have a more space to move around. But obviously it's a concern, and parents were very worried, and totally legitimate to be worried and concerned. And most of you have had students who have been sort of stuck at home for the last 4 or 5 months, and frankly, who isn't losing their mind right now? So so when you're talking about teenagers who get to Israel and then they're stuck in a room, after the first 2 days when you're over with jet lag, you're like, what do I do now? So I totally understand. So we're going to address that first. So the first thing I want to say is that it's extremely important that parents are supportive of their child in a positive way. We're going to talk about that in a few different scenarios. But this spring, there were a lot of calls I got where the parent was much more anxious, much more hysterical than the student was. The student was like, yeah, okay, I'll be fine. I'm on my phone, whatever. And the mother's like, no, he can't be there. You have to let him out. You have to speak to the prime minister. I mean, I had someone ask me to speak to the prime minister. Okay, I'm not doing that. Okay, I don't have his phone number. So what I want to say is that the goal of parents needs to be supportive on the one hand, but on the other hand, don't make the situation worse, because that's very easy. Parents have a tremendous influence over the students. So this calm student, every time he spoke to his mother in California, he was spiraling upward and upward, and his anxiety would go up with every phone call. And I finally said to the mother, look, your son is going to be okay. We're gonna monitor him so carefully, but you really need to watch your tone when you speak to him, because you're making him feel more anxious than he really needs to be. And that was the end of it, honestly. And then things got much better. Our experience was actually surprising. And I'm not going to prejudge this year's students based on spring, but we had a lot of students who had significant mental health issues, who were quarantined often completely on their own, and did surprisingly well. I'm talking about very, very high-risk students. And in each case, and I was involved in all the cases, in each case, the student had an option when he came out of quarantine to leave the country and to go back home. And each case, the student said, I want to stay, I want to stay. And those students all stayed throughout the year. Many of them did quarantine more than once, and they stayed, and they did really, really well. And it was shocking to us to see this really positive result that parents, no one was anticipating that. It was very exciting. So surprisingly, and these are kids who anticipated having a completely normal year, and all of a sudden they got thrown into a box, not a box, but a quarantine on their own. Your kids are in a much better situation because they already know what it's like to be deprived of school, to be deprived of a graduation, to be deprived of normal social life, normal outings, and they know what this year is going to be different. It's not that we're all happy about that. No one's happy that this year is going to be different, but your kids have experience that these other kids didn't. So I think that we're going to be surprised by how well the students do. So basically, talking about, you know, the students have to feel secure, they have to feel safe, they have to feel cared for. They have to feel that you are confident that the school is going to take good care of them. They have to feel that you are confident in the program that you've selected for your child. And there are issues that are going to come up. We're going to address them, but it's very important for them to have a positive message from you. I know this is really frustrating, but you know your school's going to be amazing, and they really care. And look how many times they're checking on you during the day, and what are some of the programs that they have for you when you're in quarantine, etc. And I think focusing on that is going to be helpful. For students with ADHD, you know, you have a lot of very practical options to help them. And some of this is anticipatory, meaning you can anticipate someone with significant hyperactivity is going to be restless and, you know, maybe even jittery, you know, sort of bouncing out of their seat because they can't do anything. And there are things that you could do. So the first thing is physical activity. So the suggestion that we have a mental health case manager, and she came up with these really great suggestions for helping kids with ADHD. So first of all, a jump rope is a really great thing that you could bring into Bidud. It doesn't take a lot of weight. Bidud is quarantine, by the way, and your kid will learn that the first day they're off the boat. Bidud is a great word. It means quarantine. A jump rope is a really good thing to have for quarantine. And this may not be the only quarantine your child has throughout the year. So having a jump rope means that if you have ADHD, or if you don't, you can exercise in your room, not take up a lot of weight in your bag on your way here, and be able to get some energy out. So I think that's one really good suggestion. There, excuse me. There are also some really good YouTube workouts, such as run at home or run in place. There's a really good exercise program with different timelines. So you could do a 5-minute exercise or a 20-minute exercise, and it really does get your heart rate up and get some of that excess energy out. Obviously, squeezing balls and grip strengtheners are things that most parents with ADHD students know, and that's something that a lot of the time the kids will actually bring into class to kind of have to just be able to get their physical hyperactivity, you know, being used so that they could focus on other things. So that's actually very useful. And taking more stretching breaks. So a lot of the schools have, during the 2-week quarantine, a lot of the students have, Mike just posted it. It's called Walk at Home. That's the link. And if you go onto YouTube, it doesn't cost any money. There's also an app that costs a few dollars a month. Those are good options for exercise, actually for everybody, but specifically for ADHD to get the energy out. Thank you, Michael. The other thing is, you know, when a lot of these schools have programming that's going on during the day on Zoom, even classes, some schools are starting classes on Zoom from like maybe day 1 or day 2, because they need the kids to be involved and distracted, which is a very good thing. But having some stretching breaks, getting up and just stretching and moving is very important, and just reminding them to do that is very good. Also, having some real good freedom of expression. So this really depends on your child, whether it's something creative, writing, art, keeping a diary. You know, it's really important for them to have some kind of creative outlet. Kids with ADHD are very creative in general, so giving them an outlet for that is important. Have them come with something or some things that are going to keep them distracted and interested. We had some kids with ADHD who kept a diary, and we know that ADHD, for example, they start a project and then they don't do it anymore. They start different projects. So they started writing poems, then they dropped it, then they started a diary, then they dropped it. But it's giving them something that can distract them and give them some creativity. So those are other ideas. You know your kids, so just prepare for that and to give them something to do. Regarding students who have anxiety and depression, sorry, I'm trying to keep track of my notes. Anxiety and depression, which is a very common thing for students to have nowadays, with or without medication. We're going to talk about medication later. It's very important that you avoid negative self-talk. So you need to make sure that your child doesn't start spiraling downward with negative self-talk. So anyone who's been in therapy knows what self-talk is. It's sort of telling your mind, you know, managing how your mind is processing things and thinking. And you need to encourage positive thought as much as possible. While they're still home, if they haven't arrived yet, this is something that the therapist can help them with to train them. But this is something usually that's done very early in therapy. So I'd be surprised if your kids don't already know about this. And when they call you and they are down and they're sad or they're anxious or they're nervous, and let's be real, 90% of the world has some level of anxiety right now because we don't want to get corona, and we don't want to leave our homes and get corona, or visit a friend and get corona, or go on a bus and get corona, or go shopping and get corona. So in the back of our minds, we're all a little bit obsessive, compulsive, worried about corona. And when you have pre-existing anxiety, obviously that's going to feel and take over a lot more. So I want you to keep in mind that that don't take their ranting or their depression or their anxiety, don't take it personally. Don't start in the first 2 weeks with, man, I threw my money out. My kid's going to be really unhappy. I'm getting him out of here. You need to talk them down and to address how they're feeling with a positive spin. Like, okay, but you only have 10 days left, and do you like your roommate? You know, and obviously sometimes the answer is no, I don't like my roommate, and then we'll talk about how to deal with that. Don't judge the whole year by the quarantine. Okay, that's very important. The whole year is very different than the quarantine. The quarantine is a requirement to get into the country. Remember, it may not be the only quarantine they have. It's possible that, you know, the kids are going to have other quarantines throughout the year. But it's very important to have a positive spin on as much as you can, so that you can get the support to your child, but also not to encourage them to continue with the negativity. So you need to find a balance there and parent them as positively as you can. The other thing is that remember that they've learned coping skills in therapy, and you have to encourage them to use their coping skills. If they know EMDR, remind them, do your EMDR. If they've learned self-meditation, remind them to use that. Remind them that their anxiety about getting sick, we're going to talk about in about a minute, but basically their feelings that they have in bidud, remind them that it's temporary. Remind them this is temporary quarantine. You only have 5 days left. You're getting through it really well. You're doing a great job. You know, this is really difficult, and you're so mature for being able to go through this, and the rest of the year is going to be great. So understand that throughout the year, we're all going to need a lot of flexibility also. And I want to just point to that. That's with or without pre-existing. If you are a student in a room with a roommate, your roommate has to go into quarantine. Not that they have corona, but they have to go into quarantine. You may need to pack up your stuff and temporarily move out of the room. It could also be the other way, that your roommate needs to pack up their stuff and move to another room. Someone has to leave that room. And it may be you and it may be someone else. And it may be more than one time during the year. So understand that the way that quarantine works is that if you have to go into quarantine, you may need to be not in your own room, because certain rooms are quarantine rooms and certain rooms are not. Quarantine rooms, for example, need their own bathroom. So sometimes the students have to move. Sometimes their room is the quarantine room and the non-quarantine person has to leave the room so that their roommate can quarantine. So we need to have a lot of flexibility this year, and we have to tell the kids, like, just go with the flow, okay? This is all temporary. But the key for the year is that with the pandemic going up and down throughout the year, the regulations are also going to change. So right now, for example, you're allowed to have 10 people in a classroom. Okay, well, there are other ways around that, but let's say 10 people in a classroom. In a month from now, it could be 50 people in a classroom. And then it might go down to 10 again. So we just need everyone to be very flexible. So that's extremely important. So when you want to make sure, okay. What ends up sparking anxiety and depression is when they start that spinning. And remember, the self-talk has to be a positive spin. So please work on that. If they have anxiety about the actual illness, then there are positive things they can do, proactive things they can do. For example, you could tell them, what you could do is, if you think that your roommate, went out and went shopping and didn't wear a mask properly, so all you could do is keep a distance, wash your hands, and make sure that you are wiping down your surfaces and that you are taking control of your own situation. So that's what you could do. Number one is give them, within the regulations, you have to give them activities that are going to help them take this in a positive way and feel like they have some control over their own environment when that happens. The other thing is that when you see that they're spinning and they're really having a difficult time coping, play the what if game with them. So what happens if your roommate wasn't safe and therefore they have to go into bidud? What's going to happen? What if that happens? And then paint that picture for them so that you're getting to the end game and they see that the worst case scenario is that they go into quarantine also. And what happens if you're in quarantine? Well, I'm going to be here in my room. Okay, have you done that before? Yeah, I did that the first 2 weeks. Okay, so what are you going to do to cope? What if that happens? And so you keep doing that until they realize that the worst case scenario is something they can actually deal with. And then at least you're able to sort of logically calm that anxiety down. You may have to do this every day, but eventually they will learn to cope and to be able to manage it. And we saw this really, really clearly last year. I'm very optimistic for this year. Now, if there are social issues, I don't get along with my roommate, I really think it's important to tell your child to be assertive, not aggressive, but assertive, and to communicate and to say to the staff, my roommate's a very nice person, but we just don't have good chemistry and I really need to switch. Same thing with capsules. We've heard about capsules. There are ways to switch capsules. It may not be
fun because it means that you're sort of have to be separated from your capsule for a couple weeks, but there are ways to switch capsules. And if your child is not happy, then they need to be assertive and to say, I need to switch. I need to switch roommates. I need to switch capsules. This happens all the time. And in a normal world, this is not a big deal. I just could hang out with a different group of people. But when you're in a capsule and you don't get along with people, it's harder to just socialize with people when you are 2 meters away with a mask on. So, trying to be realistic here in terms of finding a solution. But there are solutions, and all the schools have that direction for you. They should never feel like they're trapped. That's the worst thing for someone with anxiety and depression, is to feel trapped, and you have to give them the encouragement to be assertive and to be able to talk to the right people and get what they need done. I'm going to talk about medication real quick. So medication. So every school has a different health program. And I know that, I know my schools, my EMA Care schools, I know what kind of services we have. I'm familiar with a lot of school programs. Not every school has the same services. The schools who have in-person health clinics on campus, those schools may be able to give you local prescriptions for medications. You have to find out, because some of the clinics don't do prescriptions, some do, so you have to find out. If not, then you do need a local prescription. Your physician from the States or from England or from Australia that gives you a prescription is not going to be valid in Israel. So it's extremely important that you have a local prescription. Secondly, not every medication is available here. So other than our schools, we have also done, for maybe a dozen other schools, evaluations of every student file that comes in, and we find that quite a few students are on medications that are not available in Israel at that dose, or sometimes at all. So it's important to realize it's a different country, and sometimes it's very frustrating. And we've had a few situations where, the Israeli company Teva makes a generic medication for America, but it's not available in Israel. So I can't explain that to you, except that that's just how it is. So it's important to know what's available here. The issues that we see most commonly is thyroid medicine in Israel is only available in 2 doses here. So what Israelis do is we take a weekly dose, meaning if I was taking 100 milligrams a day, then times 7, so that's 700 milligrams. So that would be my daily dose divided into the 7. It gets more complicated when it's 125 milligrams a day. And so they end up rounding it like that. This may not be something that American doctors are comfortable with, so that's something you may want to bring if your child is on a dose of medicine that's not available here. The other issue is a lot of ADHD medicines are not available in Israel. Either at the dose or the actual medication. And that's a little bit trickier because those are controlled medications. So thyroid medicine, a lot of these medicines are available through telemedicine. So if you have a telemedicine service that you've signed up for or that your insurance is providing, then they should be able to write a prescription into a local pharmacy and you'd be able to pick up the prescription. If it's a controlled substance, such as an ADHD medication, then what ends up happening is that you need a physical prescription. So if you have an in-house clinic, that's where you could get a prescription. If not, then you have to go to a local doctor and get a prescription. These are also medicines that you can't get a year's worth in advance from any insurance company in America because it's illegal. So this becomes challenging. So what we generally tell people is either your doctor in the States should adjust the medicine to what's available locally, or you have to figure out how to import that medication into Israel. There's a process. It takes time. Don't wait till they're done with their medicine. And kids with ADD anyway tend to forget to tell you to renew it until they've already run out of medicine, and they will be stuck. You know, if there's no local option, they will be stuck, and that's a bad thing because it takes up to 2 weeks to get the medicine in. So please keep that in mind. You may need to track the medicine for your child. Okay. All prescription medicines are subsidized by the government. And I'm going to answer the questions on the chat shortly. I'm not forgetting you, but I just want to get through the basic stuff and then we'll get straight to questions. Okay, so it's the full price of medicine that you pay in America, if you do, and most people don't. Most people have a copayment. It's cheaper than that. If you pay a copayment, then most medicines will be more expensive here. There are a bunch of medicines here that cost 13 shekels because they're extremely subsidized by the government. Certain antibiotics and certain very basic medicines cost 13 shekels, something like that. Obviously, that's going to be cheaper than even your copayment is. So definitely it's less than $5. So definitely, you know, those kind of medications are easy to get here. A lot of the stuff your kids are on routinely is not going to be in that category, but you need to keep in mind it is cheaper than in the States, but it is going to be more expensive than a copayment, so you have to find that balance. Okay, just looking here. So also, there's a lot, this happens sometimes also, certain medicines that are officially available in Israel, they run out of, okay? I'm going to give an example of EpiPens. EpiPens, there's been a shortage internationally on and off for a couple of years already. Israel's had shortages of EpiPens. I'm telling people if your child needs an EpiPen, you know, make sure they have like 4 or 6 EpiPens, because if your child needs one and you can't get one, you may end up in a situation where you can't get him one in Israel, and that's not a medicine you want to send in. I've had bad experiences sending that in. So that's an example. 6 should get them through the year, and if it doesn't, that's, you know, that's obviously a problem. Okay. Biological medicines are also cheaper here, a lot cheaper. So Remicade in America can cost between, you know, $10,000 and $20,000 for an infusion, and in Israel the medicine is about $600 a vial. I'm giving an example of it's a lot cheaper. However, when you pay just a copayment for the biological medication, then obviously paying $600 a vial is a lot of money. So it is cheaper. You'd have to find out from your insurance company if you could get reimbursement coverage. Remember, we don't know how much tourism there's going to be. We don't know if you could just give it to your neighbor to hop on a plane here. We can't plan on that. Now, there's a lot of talk in Israel about reopening tourism. We don't know how that's going to look. We don't know when that's going to happen. Can they retract it back? Yes. So we can't rely on that. So even if they open up for the holidays, the next week they can close it again if they see there's a lot of cases. So I want to make sure everyone has a local plan as well as another plan, and that way, you know, you're prepared in all cases. Where's allergy card? Okay, food allergies was something a lot of parents were concerned with. The food allergy card that we deal with is that we give to our clients who have food allergies, has instructions for preventing cross-contamination and cross-contact. It's very important that you have a chef card that can do that, where your child will be protected. We include a list of local products that have allergens that may not be known to most chefs. So that's very important as well. Remember also, about 20% of respondents said that their family is going to be managing, the family in Israel will be managing the health system. Remember that your schools don't have medical staff for the most part. And sometimes your family members could be in quarantine and could be limited themselves. So please keep in mind that sometimes family is always great to have, but sometimes it's not 100% going to be able to solve everything. So make sure that you have a detailed plan. Obviously, if you have a brother who is a doctor in Israel and knows every doctor in Israel, you're not going to have a problem. They'll set you up. No issue. Okay. And the mental health professionals in the school, almost all the schools have somebody on staff who deals with mental health issues. Develop a great relationship with them and encourage your child to also. That came up. I think I answered a good part of the issues that we discussed. Oh, also, you need to know that private, most people have coverage for routine things that happen. So throughout the year, not pre-existing coverage, but throughout the year, if your child, gets a cold, gets pneumonia, gets bronchitis, whatever, they have the ability to go through their insurance company or health company and get care. There are private options available. So if you're concerned that your child is not getting a great answer or you need a better response, then you can request a private appointment, and hopefully somebody in the school or in the healthcare company is going to help you with that request. That costs money, but again, is still cheaper than a doctor's appointment in the United States. Okay. If our child gets sick in Israel, would we be able to get a visa to enter Israel? So, okay, that's a great question. Right now, today, no. That's the first thing. If tourism resumes, then in theory, you can have a tourist visa. But understand, if your child gets sick with coronavirus and they're in quarantine, you coming here is actually not going to help them. You can't be in quarantine with them. You can't see them. You can't visit them. If they, God forbid, have to go to the hospital, which is extraordinarily rare for this population, as we know, you're not going to be able to come with them. It's the same thing in America. If someone's in the hospital with COVID, unfortunately, they are alone. Now, I'm not going to talk about, ends of life situations. Baruch Hashem, we haven't had anything like that here. But there's not going to be a purpose to you coming. Now, if your child breaks their leg and needs help getting around and you want to help them go to physical therapy and nothing to do with Corona, if tourism is open, then you don't need a special visa. You don't need special permission. If tourism is not open, you would need a humanitarian visa, which is a process. It could be your school will help you. I know that I've helped people come in. Our clients have asked me to write letters for humanitarian reasons, for very special circumstances. So things like that are more of a possibility, but it's not black and white, and it depends on what's going on in Israel, frankly. And you would still be subjected to any quarantine rules that happen. So right now, there's still a 14-day quarantine when people come into Israel. So if you come in, you would still have to be in quarantine for 14 days and your child would not be able to join you. So, and it is monitored by the government. So it's not, remember, can you hear me? Oh, you can hear me. Okay, sorry, I pressed the button, so I wasn't sure. So keep that in mind. It's not so simple to just come in. My daughter needs to get shots every 2 to 3 weeks. Immunotherapy, can it be arranged for the visiting nurse to give her shots? So of course, the goal for this year is as much as possible to keep kids out of public clinics. We don't want any unnecessary emergency rooms for anybody. So it is important to have telemedicine available. It's important for school clinics, if possible. If you're in a very small school, school clinics are not going to be possible. Telemedicine is possible. But we want to try to obviously keep kids out of clinics as much as possible. The issue with getting shots is that whoever's giving the shots needs to have equipment. There may be additional charges. You'd have to work that out directly with the company that is providing the in-house services to see what they would charge for that kind of service, but usually it's not free. Also, if your child was getting immune therapy, you need to have EpiPens with you, because Normally, you get this done in a doctor's office that has resuscitation equipment. You may or may not realize they have it, but they are required by law to have it. So what most people will require is the minimum to have an EpiPen, which is epinephrine in case they have an allergic reaction, which will get them through the first bunch of minutes till an ambulance can come if they have a reaction. So that is something that you need to keep in mind. Is there an extra rider that can be added to the health insurance to cover pre-existing conditions? Okay, riders are a great question. So a lot of insurances sell riders that will cover emergencies for pre-existing conditions that are stable. That means if your child has been stable on the same dose of medication, has not been hospitalized, and has no exacerbations in the last 6 months, in some companies it's more than 6 months, then the rider will cover you if there's an exacerbation and they need an emergency room. It does not cover routine care. There is no financial coverage for routine pre-existing condition care in Israel for non-residents. So keep that in mind. No such thing. What we do is we do case management, which is organizing the care, managing to make sure that they get to their appointment, that they know where to go, that they get a receipt in English that maybe you could get reimbursed in America or in England or wherever you're from. But there isn't anything else. And so it says here, I saw that asthma and other conditions are not covered by the insurance. So that's AIM. I mean, I just know the insurance policy. They have a long list of things they don't cover. So you got to keep in mind that, you know, that the more things that are on the list of things that are not covered, you have to assume are not going to be covered at all. Whether they're covered if you have a rider or not and you have an exacerbation, just get it in writing. Make sure you know what you're paying for and what you're getting, because what you don't want is to pay for a rider and then to find out my kid had to go to the hospital, but you didn't cover it. And they said, well, we don't cover asthma. So, I mean, I just don't want anybody to get messed up. So make sure that if your child is on an insurance that has those blocked out policy issues where they block out certain diagnoses, that, and your child has one of them, that the pre-existing rider will cover it nonetheless. That's very important to keep that in mind. How can I arrange for an accommodation in the school, like extra time for testing and assignments? So I guess if they have ADHD or other learning issues, you have to arrange that directly with the school. I can't comment on that. Speak to the school. All the schools have dealt with this before. Okay, my son recently has been seen by a rheumatologist and orthopedist that specializes in spines. He will need to be seen in Israel. Where do I begin? So there's a few places you could begin. Number one is start with the school. Start with the insurance. See if they have an idea. Most insurances or medical programs are not going to set you up with doctors for pre-existing conditions. Some schools have connections and may help you. Look, EmaCare does this. I'm not telling you that you need to go that direction. The first stop is always the school. See if they know people and they can help you, because I don't want you to spend money on services that you don't necessarily need. Schools often have your child's not the first one to have this problem. These schools have been around mostly for a really long time. The teachers have been around in Israel for a really long time, and often they can give you a lot of guidance and help, and with love. There's no issue. They all want to help get you set up. But it is important when your child comes with pre-existing condition that in the first month or so, well, obviously not the first month because there's quarantine and Chagim, but as soon as the Chagim are over, we want all the kids to be seen by their specialists, even if they don't have a problem. In other words, I have arthritis, nothing's hurting me. You need to have a rheumatologist in Israel so that in April, when you have a flare, you already have a doctor. They already know you, they have a file on you, and you could just go in, not as a new patient, but as an existing patient, and to make sure that you are being appropriately cared for. New patients don't get priority over existing patients, so it's very important to keep that in mind. That's what I want, that's what we do for our clients. You come in, let's say you have Crohn's or colitis, you come in the first month, you already have an appointment set up, and that way We are on top of your labs. We're on top of any flare you have. We can call it. We have connections with the doctors. We'll speak to them in the middle of the night if we have to. So if you don't have a doctor, then the only place to go when you have a flare is the emergency room, and that's not where we want anyone going this year. So do the dorms have a fridge to store medications? So what I'll say is you got to speak to your dorm, and sorry, you got to speak to your school. Keep in mind that that the schools are very different. Some schools have full kitchens, some don't. If you need a specific accommodation, you have to ask. The dorm type kitchens, the little ones that we had in college, they tend to freeze medication. So you need to keep in mind that if that's what they have, that's not going to work for medication. You need something that's more of a kitchen fridge to maintain the proper temperature. So please keep that in mind. What is the policy for hosting on Shabbos? So what I'm going to say is you got to speak to your school about that. That's not so much of a pre-existing medical condition question, so I'm going to leave that to the school. Schools have their own policy. How do I fill a prescription in Israel? I covered that. They need to see an Israeli doctor. Yes, they do need to see an Israeli doctor. ADHD medications, you can only prescribe 1 month at a time in Israel, so they will need to get a prescription every month. So if you're able to have an in-person doctor's appointments in the school, then you have, then at least your child doesn't have to leave school to get this prescription. If not, then every month they have to go and get a new prescription. Will the cost of the appointment be very costly? So again, it depends on the arrangement you have with the school and with the doctor. So there's a lot of variables there. I talked about medication coming into Israel. Are there differences between generic and brand names? Yes, definitely. We use a lot of generics here, not that many brand names. So that's important to keep in mind, that your child may be on a generic medication if they need something local. And that may be the only type that's available here. So it does depend on the medication. Okay. So if your child has, oh, I like this one. If the conditions that he has includes headaches and migraines, what documentation is needed so he doesn't spend a year in quarantine? That's a great question. You know, and there are kids who have chronic sinusitis, and they, you know, you can also say they lose their sense of taste and smell all the time because they have chronic sinusitis. So I think if you have good documentation and you have people in the school who know your child, you have a medical program that knows your child, you have, again, like our, the people who are on call for us, like they know all the patients, they see the file, they know the record. So if someone calls in and says, I can't taste and smell, they're going into the record and saying, well, do you think it might be sinusitis? I see that you get this 5 times a year. Do you have any other symptoms? Then you put the pieces together. So it's very important to keep in mind. Also, the criteria in Israel include symptoms that are not common for you. So, you know, there are people who have, like I said, chronic sinusitis, and they lose their taste and smell all the time. If that's not new for you, that is not considered a COVID symptom for you. So keep that in mind. Israel understands that certain things are, in fact, unique per person. So that is a great question. I'm going to go to some of the questions that we got now on the chat. Okay, so someone wants me to contact privately. We'll do that later. How do we find out if our medication is available in Israel? I mean, again, we do this routinely for our clients. What I would suggest is start off with the health program that they're on, and see if they could give you guidance. If they can't, maybe the school can get information. If you can't do it any other way, then you can contact me offline, and I'll tell you how much time it would take for us to get the information, including the pricing. Is sertraline available in Israel? Yes, in 50 and 100 milligrams. I know that by heart. How to get insurance coverage for new pre-existing conditions? You will never get that. You would have to make aliyah. Somebody here says in the last few months their son started Entyvio infusions, I assume for Crohn's or something similar, and you're not going, no one's going to pay for that. So the answer is, even if you pay for a rider, it does not cover that. So you got to keep that in mind. You're going to be paying for that, yeah. And you know, I don't suggest that people make aliyah to get medical coverage, because it's first of all really, really difficult process, and second of all, lifelong implications. So not so into that. We've had students do that before. I don't recommend it unless you plan to make aliyah anyway. Okay. Okay. How to get the prescriptions in Israel. So it could be someone came late and did not see this, but getting prescriptions in Israel is, you need to have a prescription through telemedicine through an Israeli provider, or a physical prescription. So we recommend, if you have an in-school clinic, that you go ahead and ask if they can issue a prescription. And if they can't, you will have to go to a local clinic to get one. You can, for most medicines, you can get 3 months of medication in advance. For controlled substances, you can get 1 month in advance, and that's it. So you would need to go back pretty regularly. And no medication is covered under the pre-existing rider. Like I said, no routine care is covered, only emergencies. So please read what you're paying for. Some schools require a rider, because they want to make sure if you have an emergency that you don't have that it's covered. Some schools require a rider for management. So like we have that for our schools, for people who are here who are one of the EMA Care schools. Some students require that because they require management throughout the year. And that means that you pay for the extra case management throughout the year for pre-existing. My son has a post-concussive syndrome and suffers from migraines now and is on medicine. What documentation? Okay, same thing. Just get documentation from the neurologist and his primary doctor describing his particular symptoms for post-concussive syndrome. Again, in Israel, they don't necessarily judge that having a headache is going to mean you have corona. Fever is the most common presentation, and obviously a cough is not post-concussive. So having a headache is actually not necessarily a coronavirus symptom, and having dizziness and nausea and stuff like that is also not necessarily. So I don't think that's going to be an issue, but have a documentation and make sure that your child tells whoever is evaluating them for corona, if that's the case, or the telemedicine service, that they have post-concussive syndrome. I have just been confirmed that my son was approved at Maccabi. So that's an HMO for tourists that has a program. 30% increase due to pre-existing condition. Why the extra 30%? I don't know what the Maccabi plan is. I would have to see it. They may cover certain things they may not. You have to look. And we just don't know. And they do definitely have some things that they're not going to cover. So remember, if you're paying $500 a year for medical insurance and your drug costs $2,000 a month, it's not going to be covered. That just doesn't make sense. My daughter is hypothyroid. Are you suggesting I need extra insurance for her? So not necessarily. If you have Hashimoto's thyroiditis, which can cause a surge of hormones sometimes, that can happen. It's an autoimmune disease. That usually will require a rider. But if you just have hypothyroidism and you're on medication, you don't need a rider. Your medicine's not going to be covered anyway. It's not expensive here, but the Synthroid that they're on, for example, and the labs are also not covered. Synthroid's not expensive. So you could keep that in mind, that the extra insurance isn't going to cover any of that. Is Ventolin available in Israel? Absolutely. QVAR, I don't remember by heart. I have to look. Ventolin is not called Ventolin here. It's called it is called Ventolin here. Sorry, it's not called albuterol. Ventolin is available here. Is Topamax available? Yes, I do not know what doses. They asked if specific doses. Do you need a writer for ADHD? No, because ADHD is never going to lead you to an emergency room. I mean, not that I've ever seen, and I've been working in the health profession for 25 years. So just saying, I don't think that's an emergency situation. Usually does not need a writer. Again, ADHD, you need medication, you may need therapy, and you may need other things, but it's nothing that should require a writer. Okay, my daughter has Crohn's and was told to see a GI in Israel. Should we take out a writer? So for Crohn's, I do recommend having a writer. Because we've had students with flares that required emergency rooms, and you don't want to get stuck with a big emergency room bill, or to tell your kid who needs an emergency room, don't go to an emergency room because it's too expensive. So it is a good idea for Crohn's to have that. Most programs, like Harrell programs, I know really well. If you have Crohn's, and Crohn's makes you more prone to requiring other illnesses that are related, other autoimmune diseases. So for example, we had a kid with Crohn's. His third day in Israel, he got rheumatoid arthritis. And that actually is very common to have a crossover. The rheumatoid arthritis was not considered a pre-existing condition. It was covered, okay, by Harrell. Again, I don't know about, AIM would not be covering that because it's within the first 2 weeks. But that's the issue, that was covered. It wasn't pre-existing, even though it was related to the Crohn's. It was a different manifestation, different illness, and it was totally covered. So yes, that I would do. And also anyone on methotrexate, which this person has, that's likely to lead to a low platelet count or a low white blood cell count, which can also be an emergency. So yeah, definitely, if your kid's on a lot of these biologicals or a lot of these really toxic medications that require regular blood work, it's a good idea to have a writer. Is this being recorded? It is actually being recorded in a way that protects HIPAA. So none of your faces will be on it. None of your names will be on it. Just me. So that's great. And I think I only mentioned your name, actually. You know who. If you want, I could take your name out of the recording. It's up to you. Let me know. And but we'll take it out. I missed the beginning. We took insurance from AIM. Do we get a writer from them? You have to speak to AIM directly about their programs and make sure to read the fine print. Okay, so I think that's it. Are there any other questions that you have? I think I covered quite a bit of information. Is there anything that I said I was going to talk about? I don't think so. So, okay. You're very welcome. Someone said thank you. So anyway, it's great to see you all, well, to see that you attended. I think you're going to have a great year for your children. It's going to be very special. They're going to get the care that they need. I hope this has been helpful and informative, and I wish everybody a lot of hatzlacha and shana tova. Take care, everybody. Bye-bye.
Thank you.
You're welcome.